All right, so I'll go ahead and start chattering at everybody, but of course, keep taking care of yourselves. Get whatever you need. I know everybody's probably had a long day. So I want to start by welcoming everybody. This is probably our sixth or seventh virtual town hall for GPA. And this has been a wonderful way for us all to connect in a pandemic year when we're seeing so much less of each other than we normally would. But it's also created great accessibility for all of us to get together at the end of a day when none of us feels like getting in a car and driving to a meeting. It's great to be able to log on for a few minutes and just connect with what the association is doing. It's been a great way for me as president to be able to let people ask questions and also to communicate a little bit about some of the initiatives that the organization is undertaking right now. For those of you who may not have met me before, my name is Dr. Rachel Kieran. I'm currently the president of GPA. And we probably will have some questions or some time for questions at the end. Certainly, I'm happy to stay on and answer questions. But we also are very, very grateful that some of the leaders from our health psychology task force are with us today and are going to talk a little bit about the work that task force is doing. So we're going to have a little bit of a focus today, not in a super formal way like a continuing education event, but we're going to talk about health psychology and when could be more important and more relevant than the year that we've had to talk about the intersection of health and psychology. And we're very grateful that Dr. Stella Nelms and Jen Steiner are with us today. And I'll let them introduce themselves and talk a little bit about what they've been working on. But about a year ago, they formed a health psychology task force for the organization to look at the role that this important area has in all of our lives. So we're going to talk a little bit about that today, and they're going to tell you a little bit about not only this field, but also what's happening in GPA with this. So I can't thank them enough. Taking on a new task force in a difficult year is impressive. So Stella and Jen, take us away.
Thank you. I don't have a huge amount of slides because I think we get enough of that doing virtual work these days. But Jen and I just threw a couple of slides together just to kind of guide our conversation, but I really want this to be interactive. So I am currently the pain psychologist at Emory. I've been at Emory for about 2 years now. I'm doing a lot of CBT working with patients in palliative care. I was at the VA for roughly 12 years, at the Atlanta VA for 9 years doing palliative care and working on the inpatient unit primarily and doing some outpatient work. And then everyone probably knows Dr. Steiner, but you wanted to say something really quickly?
Yeah, I'm also a health psychologist. I was the pain psychologist for the Atlanta VA for the past 6 years and recently left to deal with family matters. But I'm still very active within health psychology and ABIPT in clinical health psychology. So really this is Stella's baby, Dr. Nelm's baby. I'm just here to lend support. So
thank you. Yay. So before I get started, I really just wanted to just ask people that are on the call, those who identify as health psychologists, just say yay, nay. Those that are on the call right now.
Yeah, I don't know that I would identify as a health psychologist just because when I was in training, they didn't really have that designation at that time.
That is true.
I am a licensed RN.
No,
and
okay.
I retained my license. I still have it. And I started off my professional career as a cardiac intensive care nurse.
Oh, wow.
I did that for some years. And then I went over to psych nursing for a break. And I ended up really liking it. So I spent 6 years working inpatient psychiatry. And then decided I wanted to keep doing this. So then I went on to graduate school and later I got a master's in MFT and then a PhD in counseling psychology from Georgia State. So I see a lot of medical people and I do a lot of sort of oncological transitional type things, but there was not such a thing as a health psychology program at that time.
That is true.
Right. And I was on staff at St. Joseph's and I was on staff at Dunwoody Medical Center when there was one. So I've had experience with that kind of thing, but I'm sure it's a slightly different kind of experience. One of the best things about my nursing degree is I know what all the words mean.
Yay.
When I'm talking to when
That
I'm
really
talking
helps,
to
doesn't
I
it?
know exactly what he's talking about, and I know
Oh
how
my
to
gosh.
start, so.
It makes all the difference. Yeah. I
Isn't
gathered
it?
a lot of experience working at the VA as well. I'm sure Dr. Steiner, I'm not going to speak for her, but just working at the VA, working in palliative care and working with oncology and just learning the transplant, just learning a lot of language that I think in my regular training, like an internship, I wasn't exposed to that as much. It was my postdoc training where I really got exposure to it. And when I got to the VA, it was like, well, sink or swim, you better Google what that means because I have no idea. Talk to you as if you should know what it means. So definitely the language is a big deal.
Yeah, that was like a big help right from the first. That this fishing degree is doing me well. I know what they're talking about. So.
That's one of the biggest when I was at the VA with trainees. That was the biggest challenge, is that they were like, okay, I feel confident in the interventions. I understand what we're doing, but I have no idea, how to approach this from a medical perspective or what the physicians are saying. So yeah.
And should we being able to read a chart before seeing a patient?
Right.
Of what kind of medical conditions are we dealing with? Is this something that is curable? Is it something that's manageable? Does it come with a lot of pain and distress? Like, what does that look like? So that's very important. Well, thanks for sharing that with me, Dr. Peeler. How many of you are here because you want to learn more about health psychology or more specifically what GPA has been doing in this area?
Yes.
Okay, good. So what I'll do is before talking about specifics of the task force, I do want to talk about kind of what you see as some of the issues that are coming up for you that are health psych related. That you might think that, you might not know if they are or not, but some of the things that are coming up for you kind of in this moment now, after we've just dealt with 2020 and now we're in 2021, which doesn't look much different than 2020 is the way that it's turning out. But any ideas or thoughts or anything? Because I can sit here and do all the talking, but I'm trying not to do that. I tend to do that. So just about that. Yes.
Yes. So I've worked with a team of medical doctors for about 17 years. So I've done behavioral medicine with them. But what I'm seeing now as a result of COVID, I'm seeing people come in with sort of unexplainable symptoms, very young individuals who have never had any cardiovascular issues are reporting that they're having heart palpitations, they're having headaches, and this is post COVID infection that didn't result in hospitalization. So I think there's a sense of, I got COVID, I certainly beat it, but there are these long haulers that are still presenting with various sort of seemingly idiopathic symptoms.
Yes.
That just sort of temporally are occurring during this pandemic. So I think that learning more about how we can work with the medical team, I think it's crucial right now. I'm actually in a prescriptive authority program, and I'm actually, I think I have one class left.
Okay.
So I see the intersection in that as well. But currently I'm seeing a lot of people come in who, again, are diabetics and who are hypertensive and who are migrainous. And there are just so many more episodes that they're having that I think, well, I'm just seeing a whole lot more of the pain and more intensity of it.
Oh, thanks for sharing that. I definitely would, I probably will touch a little bit if I have remembered to about the multidisciplinary approach. That's something that I take to heart because I did that at the VA and I'm doing some of that at Emory right now. But the long haulers, which I believe that they kind of titled that name for themselves. I'm seeing some of that. I'm treating a couple of patients that are post-COVID, but one that really stood out for me, and it's actually not a patient of mine. It's actually a good friend of mine who was a social worker at the VA for, goodness, probably 15 or so years. has a loved one who is a paramedic, did not get the vaccine in time and ended up getting COVID. And this is someone who's very educated, very just, not that you need to be that to be careful with COVID, but just very careful, not going out, not eating out, doing all the things that we're all supposed to be doing, cleaning hands, all that stuff. Anyhow, got it from her loved one who was working as a paramedic and still being very careful. And so I just kind of checked in, how are you doing? I sent her a little gift, and she's having the symptoms, no smell, no taste, and some congestion. Didn't need ICU, doesn't need to be on a vent, no oxygen, doing fine. Her loved one's doing fine. And she says, you know what, Stella, it's really the thing that's really challenging. She said the psychological effect of knowing I got COVID. She's like, I am just dealing with that. I'm embarrassed that I got it. I'm mad that I got it because I feel like I'm doing all that I can. I feel like other people aren't. I'm mad that my loved one got it. He's a first responder. And the psychological effect is actually impacting me more than the physical effect at this point. So when she said that to me, that really stood out big time for me, because I'm working with patients who are dealing with both cognitive challenges, hair loss, the anxiety and depression that were kind of already there, which is why they were seeing me, but now even more intense. So, okay, we're going to move on. For those who don't know or are just learning with health psychology, a lot of different ways that has been described. Behavioral health, behavioral medicine, medical psychology, and there are some other ones that I might have missed. Health psychology looks at the biological, the social, the psychological factors that influence health and wellness. Health psychologists use psychological science to promote and prevent illness and improve healthcare and the healthcare systems. I actually use this model in my work. I do a lot of CBT with chronic pain patients, and I use this model as a template for their first couple of sessions to talk about how these things interact. And oftentimes it's like light bulbs come on for people when they recognize that the fact that they're isolated and they're not around a lot of family members or a lot of friends, or they're not connecting with others because of their health challenges, how that actually is impacting their quality of life, how that actually has an impact on their health and their mood. Or looking at like their financial challenges and thinking that, well, it's just affecting my medication. No, it's actually a stressor, and for some people. And so kind of looking at how these things play a role in their overall health. So this is a model that I utilize on a regular basis. I actually use it at my sessions, and I have to do it online, but I have a big old board in my office, and I have different colored markers, and I say, okay, so let's talk about what's going on from a biological perspective. Let's look what's going on from a sociological perspective. Oh, I just got a recent divorce. I'm trying to go back to school, and I have, chronic neck pain. And, from a psychological perspective, I'm afraid of my medications. I'm afraid I'm gonna get addicted, and I don't have any coping skills. And so we look at all that together. So I actually use this model a lot. Any questions about any of that? So our role, and so as health psychologists, and Dr. Steiner, please jump in, or others that have more to jump in to add to this. And this is an exhaustive role, but just some of the things to look at, exploring what motivates people to embrace health promotion and illness prevention. I've seen patients from the perspective of, and I have some now in my clinic where, they exercise every day, and they're taking their medications as prescribed, and they're following, the rules of what they're supposed to be doing for health. And then I have those with same conditions, but, really struggling with their medication use, afraid to take medication, afraid to move because of pain or other challenges. And so oftentimes I look and see what are the motivators for people, and then what are the external factors, and what are they getting good support from their family? Do they have access to these things, these type of things? I have a couple of chronic pain patients with spine conditions. Being in a pool is actually very beneficial, but finding a pool is difficult. Insurance doesn't always cover aqua therapy. Now we have COVID, so they have some patients who are afraid to go to a pool, which is understandable. So access is a big piece of that. Examining how biological, social, psychological factors influence the choices we make about our health. And exploring factors that allow or hinder people from recovering from illness or coping with chronic conditions. And I have a patient now who has diabetes, has had a good portion of his adult life, has a significant weight and BMI, but is also a caregiver for a parent. So being able to exercise and work on a healthy diet is completely just thrown out the window for him. He sees it not as an option. My mother eats these foods, so I'm going to eat these foods. And so all these things are impacting his condition and making it more challenging for him. So muddling through, the things that he could be to kind of make some healthier choices that fit for him, that are financially affordable, that he has access to. Oftentimes that plays a role in a lot of the work that I do with the patient.
I think the only thing I would add to that is that for me, when we talk about being a health psychologist or just practicing health psychology, it's really truly about that intersection of the psychological and the physical or the physiological. And I think we're all most people are looking at all of the factors that influence one's mental health, but really I have lived as a health psychologist is directly, how do these things impact one another? And how do we address both of them in a cohesive way? And I think that's the unique kind of value add.
Thanks for adding that. Yeah, definitely. So first, before I get into the task force, any questions or comments? And I'll talk more about kind of our role, and and if there's time, even I can we talk about any patient challenges that we have, particularly during COVID. But anything else that anyone wants to add, please feel free, and then I'll talk about the task force and kind of where that got started. There we go. All right, so kind of starting out, kind of the why and the how for me. So after I left the VA, and the VA is a very different environment, and since there's a lot of people to collaborate and connect with, and that's the case at Emory. But when I got to Emory, I came into this new role. I was like, okay, I need to find my tribe within the Emory community. The VA is over here. I can only do so much with that. I need to kind of find my tribe here now in this new environment. And I really struggled with connecting with, I think I connected with 2 providers that were awesome, and we connected and we had lunch, and it's like, wow, there really aren't a lot of us, or maybe people just don't identify with being a health psychologist, or maybe try to figure out what that really means, right? Maybe they're doing it and don't realize that they're in that role. So I felt like, well, a combination of that piece and then getting involved with GPA in a more aggressive way, a more active way, and then looking at what different options, how to get involved, and nothing was sticking for me. Nothing was like, ooh, take this and run with it and get excited about it. I mean, great committees, but nothing was just like picking at me. And I'm like, well, I really like what I do. How do any of these fit for that? I want to, if I'm going to participate in meetings quarterly and doing all that stuff, I want it to be something that gives me enjoyment. I really like what I do for a living. So that's when I said, well, how about something in health psychology? So that's kind of where that baby started. And so that we've been a task force for a year now. So I'm very excited about that. And then kind of just recruited in terms of other folks that identify in that area, and just kind of checking, like, hey, I know someone who works over at Grady, I know someone who works over at the VA, and kind of really kind of connecting with others, and then connecting with people that were already part of GPA and very active. So we have about including myself, about 16 members now. So I'm very excited about that. And what I'm even more excited about is how diverse we are. We have people in terms of diversity, in terms of work settings, pain, palliative care. We have transplant, pre-surgical assessment. We have people that focus on weight and bariatric surgery. We're also diverse in terms of just social identity, males and females, multiple race representations, which we're still working on getting more of individuals from different diversity areas there, but different age groups and people at different stages of their career, which is really important in the sense of, folks who are just kind of coming into this field who actually probably had more specific training in health psych, and those that maybe came and said, hey, I just gathered stuff over the years, turns out I'm a health psychologist. So oftentimes it's nice to have that diversity as well, and folks who've been in the field for a long period of time versus some of the new earlier career psychologists. So that's kind of where we got started. Then we'll talk about some of the things that we're doing. All right. Okay. So when we got started, really kind of thinking to myself, like, what do I want this to look like? You know, and initially, I'll talk about the pre-COVID ideas versus the now. All of this started right before COVID started. I think I presented to the board in January. And so, you know, I think our first meeting was February, and then it just kind of went downhill from there in terms of what was happening in the world. And so initially the thought was kind of working on a needs assessment in terms of psychologists working to try to figure out what are psychologists that work in behavioral health fields, what are their needs? What are some things that would be very helpful for them? And we started out using, just getting some data from it. I think it was a membership survey that had already been submitted. And so was able to kind of extrapolate some data from that and kind of looking at some different health psych issues. A lot of stuff on ethics came up as something that was important, body focused approaches, telehealth now. At the time, looking at like psych pack, people were asking about psych pack, and eating disorders and just integrated healthcare issues came up. And that was just kind of a general membership survey. This was pre-COVID, pre-health psychology task force. And so I was able to look at that, and then meeting with the task force, kind of figuring out, you know, one thing, we have such a diverse group of individuals, which is great because that means diverse topics, people from different settings, different backgrounds and training. And so we talked about different CE options, and man, I mean, just the floodgates open to all the different things we could talk about. It's like, okay, we got to narrow this down at some point. And then COVID came. And then we started thinking differently about, well, those topics are great. However, we now have people who are dealing with isolation and people who are having issues with access to their medical care because of COVID, and chronically ill individuals having a lot more challenges with getting to their PT appointments, for example, or getting access to their medication. So all of a sudden our topic idea started shifting with COVID. And so we just had to kind of reorganize and figure out what's going to be really helpful. And so part of our goal was getting some CEs, which we were able to do in December, which was very exciting. And my hope is to definitely do some more this year. And I think more than anything, try to find a way to find out from others, what are those topics going to look like? What are some things that are going to be really important for people? You know, I think, you know, bringing up the, you know, looking at working with a multidisciplinary team, Dr. James, maybe even talking about like long haulers and what are some of the post-COVID issues that are coming up. So we're definitely going to be focusing on topics that are going to be very helpful for people moving forward, you know, current and post-pandemic. Because I think that these are issues that are going to be here, you know, moving forward, even when we are in the clear and maybe just wearing masks just for the heck of it. And then finding a forum to really connect and network with others was my biggest thing I was excited about, was, you know, doing a social event and, you know, and having a way to connect with others, and then COVID came. So then it was like, okay, so we just have to think about this a little differently. And a lot of it's just been emails and kind of finding virtual ways to connect with others. Dr. Steiner and I did over the summer, put together something for the newsletter on health psych. And we got a couple of folks that found that interesting and sent me emails and was interested in joining. So that definitely reached out to others. So I think I want to continue to do things like that and put stuff out in writing so people kind of know what we're doing, what we're working on, and different topics that would be, I think, be helpful for the mental health community, the psychology community for GPA. So definitely want to continue that in terms of reaching out to others. The whole social thing on Zoom, yeah, I don't know. Virtual with a glass of wine just doesn't do it for me, but I'm open to that if that's one way to kind of have some ways of connecting with others, but we'll find some ways to be creative with that. And then just increasing GPA visibility, and those interested in health psychology, those who are trying to find a home with a task force that kind of works for them in terms of like wanting to be active and get engaged in this. So that has been kind of my goals moving forward, and definitely with talking with other members of the task force, all in agreement with that. So any questions about, because us as a task force, and you can always send me an email separately about the task force. I'm more than happy to answer any questions. If you're interested in becoming a part of it, definitely let me know. Okay. So I guess kind of just talk about some of the issues that lie ahead of us. And clearly it's more than 3, but this is just kind of giving some basis for a conversation to talk about what are some of the things that we see happening as health psychologists, as clinicians and researchers overall. But, you know, again, kind of coming from the perspective of working in health psych and some of the challenges that I'm seeing, a lot of still is unknown about the lasting medical and mental health effects of COVID. I mean, that has been a big issue, but not just of COVID, but just being quarantined, not having access to travel and seeing family members, the isolation issues, you know, whatever your routine was, and that being completely upended, but really looking at the lasting effects that this has had, not on just, you know, our patients. Obviously, I'm talking about those with chronic issues, but I think as us as providers as well, how that plays a role and what that does for us. A big part of our role as health psychologists is to help with mitigating the interaction effects of the physical on the mental health, right? So, you know, we're in a position where we are able to help people in terms of understanding how their body and their mind and how those things connect when it comes to other conditions that they have. When depression leads to decreased compliance with medical regimens, when a person is isolated and they already have depression and anxiety, and then we're adding another layer on it. I have a patient with severe anxiety who has not left her house since March, won't go get her mail because she's afraid the air around the mailbox might have COVID. So this has been huge for her in terms of being able to get to her medical appointments, to get her medication. So this has been a huge challenge. And so I'm working with her and with some family support to help her kind of navigate getting her needs met. But these are things that are really important to look at in terms of how those things, how those are affecting her physically, because her blood pressure is now going up and so she's having a lot of other issues. COVID presents a health risk for those living with chronic medical conditions. And for many, the pandemic has had a significant impact on their ongoing medical and mental health care. I have to say, I'm sure I could talk for a lot of folks. I have never been busier since that this has been available, being able to do telehealth. You know, the bads of it, I'm not able to see my patients in person. And the goods of it is that I have patients who I probably wouldn't have been able to see. They would not have been able to either travel to me if they're an hour and a half away and they have chronic back pain, or if they're elderly, if they, you know, live in a rural area and they have a hard time getting access to appointments. So it has been something that I'm happy about, that I've been able to reach these individuals. As psychologists overall, we should be working towards providing tools that help mitigate the development of these serious psychological challenges during the pandemic. A lot of times, you know, it's become an issue where a lot of my patients who I'm seeing who've had chronic depression, or, you know, and then we add on increased isolation. I have a couple of patients who live alone. So this has been an added concern for them in terms of just having some kind of access to others in the community virtually in most cases, and trying to get people connected. It's also too, I think you mentioned about Dr. James, about interdisciplinary team. That's something that I've had to do more virtually than I've done before. I just pick up the phone, I walk over up to the rehab hospital and talk to another provider. Now it's like reaching out email and saying, hey, I'm checking in. This patient, you know, has been taking more medication than she should. I'm really worried about her state of mind. And so being able to connect with other providers is something that I consider very important, and had to be a little bit more, you know, had to approach that a little differently in the virtual world during the pandemic. So I'm gonna stop talking and see if anyone has any questions or thoughts about any of this.
I think about this a lot, about how, you know, I've always identified as a health psychologist. And so this is my wheelhouse. This is how I think about care, from this kind of integrated approach. But I think many people who maybe didn't identify as health psychologists or had no interest in the area are going to end up having to dabble in kind of the biopsychosocial model, and gaining a better understanding of how these things interact, because COVID is so widespread and we don't know what these long-term effects are going to be. And not everybody can get to somebody who designates themselves as a health psychologist. And so I personally think it's really important that everybody kind of have a foundational understanding of how to do integrated care, or how to bring these ideas together so that you can talk with your patients about how they inform one another. Because I just think that's what we're all going to be doing for a long time now.
Yeah. I would really strongly agree with that, Jen. Actually, I would echo the very beginning of your sentence there, that everybody would represent themselves, call themselves a health psychologist, and I haven't, and yet I would always have kind of had an eye out or an ear out for the integration of what's going on with this person physically. And I blame it. I joke that I'm a neuroscience nerd, just as a sideline. But it gives me that, and I had a parent with cancer, and so I know how to read medical stuff just out of my own interest. But you pay attention to, and you learn a little bit about it, and you integrate whatever knowledge you have into the work that you do, because we are holistic human beings. And so I think that integrative approach, I have watched it more and more inform not only the work that we do, but the way that we train our young colleagues. And so it was part of the reason that I wanted us to talk about it today, not only because I think task force is important, because for the field of, anybody who identifies as a health psychologist, but because I think we're living in a world where we need to take a much more holistic approach to people and recognize that, as your psychologist, I can't say, oh, well, I just can't worry about your food insecurity.
Right.
Well,
Yeah,
if that's the case, then anything I do is useless. Yeah.
exactly.
Yeah.
Exactly. Thanks for sharing that. Yeah. Any other thoughts or comments or questions from anyone else on the call?
I think Troy had a comment, but you might be muted, Troy.
I was. I just wanted to sort of piggyback off of what you and Dr. Steiner said. For me, I was actually intimidated by the concept of health psychology, because I thought, oh, wow, I have so much to do in this session. Now I've got to sort of come up with a diet plan and an exercise regimen and sleep hygiene, sleep log, etc. And right now, I can't see not doing that. So I agree. I think that we're all going to sort of shift our perceptions about who we are professionally, whether it's conscious or unconscious. But I think it serves the patient much better, the client much better, and it sort of creates less of this chase between clinicians, between providers, where the physicians are doing one thing and perhaps the therapist is doing another thing. But if we're not sort of like putting it all together for the patient, it's been my experience that the medical professionals do not sort of integrate it all for the patient, so that they can understand how this is affecting that, and how if you address this issue perhaps in a psychological way, it gives you energy to psychological energy to approach some of these other issues that they're treating. So I do see the shift happening.
Yeah.
That was so beautifully said, but I agree. A lot of times it doesn't come from the physicians, or and it may be, they're due to outside constraints with the time that they have with their patients, but it may also be training or not knowing the right way to broach those topics. So I think, yeah.
I know I'm finding, I have a couple of providers that I know really well, and I'll look in their chart and they'll say a patient came in with a lot of anxiety, is asking for more pain meds or asking for whatever they're asking for, and refer Dr. Nels, because I think they recognize. But occasionally it'll be a little blurb in there, talk with the patient about how anxiety can impact pain. I'm like, yay, refer to Dr. Nels, and then that'll be the next sentence. So it makes me feel good that they're able to kind of recognize those and have those conversations with the patient, not just recognize it and kind of chart about it, but actually have those conversations with the patient. That, yeah, you are probably experiencing real physical pain. However, we've noticed that you keep coming in, And guess what? Those medications are not going to take away that anxiety. They're just not. It's putting a big old Band-Aid on a bullet wound. It's just not going to do it. So I'm noticing that some providers are taking that time, but a lot of times I'm finding that they're just missing that boat, and I see no notes and they just send them to me. And then the patient's like, I have no idea why I was asked to see you. Maybe I think the pain is in my head, and that's typically the response I'll get from those people who don't get those conversations from their physician. So.
Yeah, I've found that that a lot of physicians are grateful that they have you to send them to, because they're going, okay,
they are.
I want to, first of all, I want to cover it that I had this, that I sent them to someone, as liability reasons, but also because that's not what they do. And they don't even want to do it, so there's a certain amount of gratitude that they have someone that they as go-to people.
Everyone should have their lane and stay in as much as they can.
Yeah.
So it's good that I have a lane they can send the patient to. So that's good.
Well, it's good to have that relationship. And I think with a lot of private practice physicians, you can, I don't work in a clinical setting, but.
Right. Well, that's one of the things that when I was putting together the task force and looking for people to join, I really wanted to make sure I had a diversity of people that were doing private practice, those in maybe nursing home or long-term care facilities, those in the hospital setting, those in the academic hospital setting. I really wanted to have some diversity because I recognize that health psychology does not just kind of fit in a hospital. I think that, there's people that are doing outpatient work that work with a large chronically ill population. Those, that are doing private practice work and maybe they moonlight in another environment. So definitely that's one of the things that was important about this task force is that we have that diversity of individuals coming in and be able to provide their knowledge for us. So thank you for that. Anything else? This is fun.
Yeah. I know that you all are still in planning stages and that so many of the things that you had planned for this year completely sidetracked and you had to revision. But are there thoughts that you had, Stella and Jen, and anybody else even wants that you may have for the task force as you move into future years?
Yeah. So one is I'm hoping to eventually meet with the board and hopefully become a committee. That would be a goal of mine. And I believe as a whole, I'll speak for the task force. Why not? And so that's one. Two, our CE training options that are out there, particularly in light of everything that's been going on. I mean, there were a lot of topics that we had all just kind of came up with and brainstormed before COVID. And so now with COVID, it's like, okay, where do we even begin? So really kind of prioritizing what that looks like and trying to find a way to kind of get more of a needs assessment from what people are really wanting and what they're needing right now. And I think we're in a position in the environments that we're working in, since we have such a diversity of people working in different settings to kind of get a sense of what that looks like. And then as Dr. Steiner and I have talked about is, the fact that a lot of people don't identify as health psychologists. So that means what as health psychologists can we do to help with, being the fact that you are going to be working with patients that are long haulers, that are dealing with isolation and other health challenges. Like how do we help providers that are in those positions to navigate that, and provide support and training as needed, ethical challenges that could come up, which can definitely happen when working with chronically ill patients. So I think that from an educational standpoint, definitely want to do that. And that can be in the form of CEs, doing newsletter articles, stuff like that, that I think could be very helpful. And then trying to continue to do outreach with others. I think Richard mentioned about connecting with maybe other committees and kind of seeing how we can do work together and collaborate in different ways. So I definitely would love to see that as another check off on our list of things that we could be doing this year. That's kind of where I'm at right now from a kind of social gathering and networking. I don't know if Zoom is what I really want to do right now. I do so much Zoom. But again, I'm definitely open to finding ways to kind of just have like a social event or something to that effect that might be virtual. But right now, my priority is probably more education and reaching out to others in the field. And if I missed anything, Dr. Steiner, please jump in.
Hi, everybody. I'll chime in. So I'll say that I'm really thankful that Dr. Nelms is putting this together. And when I came back to Georgia after my training and found a career here, GPA didn't really have a home, so I didn't join. And it was as I was kind of just working with Division 38, which is APA's health psychology division, and I stuck with that. So when I caught wind of this, I wanted to be a part of it. And so that kind of excited me and got me to kind of come on to GPA. I would imagine there would be other similar stories. So I think this is a great profession and kind of a way to help disseminate our subfield. So thank you for that.
I think I actually wrongly assumed that there weren't that many health psychologists in Georgia. It was just when I came to Georgia, it didn't seem like there were that many. And I think what I've realized now after doing this task force work is that I just wasn't connected with those individuals. I kind of had my little bubble from the work environment that I was in.
Yeah.
So that's been really wonderful.
Yeah.
Sounds like you're all too terribly busy doing too much work for too many patients to do a lot of PR. And I think that's a challenge that we have with a lot of our different areas. You know, we all work in our busy little lives. And we often struggle to make it clear that we want to infuse the needs of all of our members in all of their different areas throughout the organization. For example, I'm gonna call on Jen Steiner for a minute because she's also the chair of our continuing education committee and does unbelievably stellar and hard work there, making sure that we're meeting the needs of everybody in that group, and it's very difficult. And so that kind of has a list as long as or as tall as I am of all of the different areas of psych that we are trying to hit. And so it's a challenge. It's a challenge. So Stella is absolutely right in thinking about, you know, how can we work with all of our different committees to not only let all of our professional colleagues know that they have a potential home in GPA, but also to let the public know. When could be a more important time to let the public know about the integration of physical health and mental health? It's not that it's never been important before, but it's certainly coming to the forefront right now.
Well, it also seems to me, having been at it for a good long time now, more than a year or two, that more and more people are not going to be able to be doing private practices, independent private practices anymore. They're shrinking. And so it seems like the future is going to be in this integrated care area of getting people into these teams. Is that not correct? I don't find nearly as many people being able to support themselves doing a full-time private practice only anymore. It's just with insurance changes and stuff like that, I don't think there are as many of them who aren't also doing something else. Do you know what I mean?
I don't know. I think we'd have to see a climate survey on that over, you know, in terms of broad strokes. Certainly working with the insurance companies is a challenge, but that idea of integrative care, I have a bias. I've always had a bias. That has always been a concept that has appealed to me ever since the early days of my training. But as somebody who works with patients who I see needing integrative care, I am constantly frustrated, wishing that I had a psychiatrist next door to me that I could check in with frequently and be like, okay, here, you see this person too. And also, wouldn't it be great if we had a, you know, a chiropractor and a primary care physician, and, you know, that kind of collaboration we are going to have to figure out ways to do in order to take holistic care of our patients. And it's very, very difficult in the era of having to turn over. I happened to overhear a horrifying conversation at my doctor's office one day about how many minutes they got to spend with patients, which told me something about how many patients they had to turn over in an hour in order to essentially be able to stay in business.
Wow.
You think you get 10-minute appointments with your doctor? You're right. Because they have to book 6 patients an hour in order to be able to bill enough to sustain the practice.
And they don't.
And then we wonder why we don't feel like we're getting calls back from our colleagues in large practices to collaborate care?
Because they can't bill for that, or
Yeah.
if you can bill for that, because there is a code where you could use, it's extremely small in terms of what you get back for
Yeah,
it.
if anything.
Right. And so it doesn't exactly, I think, motivate the collaboration. I think for a lot of people, the internal desire, they would like to, but it's not feasible.
Yeah.
I would say also those alternative payment models. So I work in a residency program, and if I wasn't primarily teaching, integrated primary care would not pay my mortgage, right?
Mhm.
So so I'm thankful for that. The alternative payment models, we're leaving a lot of money on the table, but the startup cost is not
Yeah.
particularly doesn't look good to the C-suite. So
Yeah. It's a big challenge. I think we're facing I mean, this is a personal thought, a personal consideration, curiosity that I have, but I think we're facing a potential need to make sweeping changes in order to really do good work. But it's a frustration that I feel a lot because I want my patients to get the best possible care.
That's right.
Yeah.
That's right.
Obviously, I'm in independent practice, or not obviously, I'm in independent practice. I've been in independent practice all my life, or at least my adult life. And for those of you who don't know me, I do a lot with bariatric surgery. I'm on the task force with Jen and Stella and whoever else that I don't recognize. I'm sorry. And Stella's done a terrific job. She knows I've said that. She didn't pay me, but I'm glad that this is happening. I've been in the physical medical aspect in terms of mental health of healthcare probably for about 25 years now. And my getting involved in that has changed the way that I think about working with patients, whether they're coming in with a very specific physical medical related issue or not. And that's where the holistic piece of this is important. And that's certainly where I see that we can educate psychologists, both at annual conventions, maybe at CE workshops, maybe newsletters, whatever, just about how, while integrated care is really important, integrated care also happens between you and the person that's sitting in front of you. Just in terms of being able to think differently about a patient who may be coming in for depression, or start asking about medical diagnoses, the kind of treatment they're getting for that, whether or not they're getting access to reasonable access to treatment, because we know that some populations don't get the same level of access, not treated the same way by primary care physicians. And so it's helped me to think in a much more macroscopic way about the things I need to consider when I'm seeing a new person, so that not only do I get to know them, but that I help them to get to know themselves in a much broader way, and how things impact their quality of life, and how that they can make some positive impact on that. I wouldn't think that way if I really hadn't gotten into this area that I've been in for all these years.
Thanks, Dr. Ritz. I definitely love having you in the task force because you definitely bring a different perspective. You brought up some stuff that I was like, okay, I hadn't thought about that, like billing challenges and bariatric work and private practice work. And so that was definitely diversity that our task force definitely needs. So thank you.
The other thing that's interesting, and I can't say anything now about it, but I'm a co-author on an research study that was coming out about tele-evaluations, doing telepsych evaluations that's coming out in surgery for obesity and related diseases. And I'd love to be able to share what we found once it's actually released, which should be next month.
That'd be great.
I can't wait to hear about that, because I know I was trying to do some of those evals via telehealth early in the pandemic, and there were a lot of ethical challenges around it and practical challenges around it. So I can't wait. That'd be great.
Yeah.
Are there other questions or thoughts people have related to health psychology or GPA's role in all of this?
I do want to take a moment just for a moment of advertising, if we're at a point where I can do that. That, you know, the Georgia Psychological Foundation is doing, we're pairing with one of the radio stations, and we're doing 3-minute mental health moments. And so any of you that are interested in doing that, get in touch with me or with Betsy Gard, and we will be talking to you. We would like to get a lot of people doing them. So.
Absolutely. And the foundation is certainly an important one to mention when we talk about collaboration across the organization, and the foundation and the PAC and the association all work very closely together. But obviously, you know, health psychology in its purest clinical form is, as Steve said, it's between you and the person who's right in front of you. But of course, I think all of us are so aware of this idea of that. I teach, and when I teach about my students about, you know, 3 levels of prevention: primary, secondary, tertiary. When I'm doing therapy, I'm tertiary prevention. But if we can do more primary prevention, I have to do less tertiary prevention. And so when we talk about public education, we need so much more of that. It can affect so many things. And so our ability to do public education in all of the fields that we work in and around all the things that we know really has the potential to change so much. So certainly getting involved with public education at GPA and through the foundation, hopefully has the ability to really make a difference with some of the things that make all of us clutch our hair on a daily basis. I know we're getting to 6 o'clock, and the original invite, I think, said that we would end at 6. We certainly can do that. And obviously if anybody has to go, no one will be offended. I am happy to stay on and take some extra time and to let this conversation continue. My intention had been to kind of re-advertise and be like, look, we can continue to 6:30 because I know that we wanted to have a slow start. But we also can talk about anything else that's going on with GPA. If anybody has questions or comments or thoughts. So very grateful to Stella and Jen for sharing the really great work that the task force is doing. This is really exciting. It's such an important area with connections to all of the other work that all of us do, which I think is really great. So
Thank you.
Bright future. Yeah.
I don't have any questions, but I would like to say I really appreciate that you've put so much time and energy into putting together this task force. I can imagine how much you had on your plate and on your mind to get going before COVID hit. And, you know, I think you're exactly right that, you know, continuing to keep the thread of conversation going and people's interest going so that they know how they can contribute and help is really valuable, because I completely agree that the landscape for mental health is changing very rapidly. And as we come out of this, a lot of people are going to need additional services focused on this.
Thank you for that. You know, in all honesty and full disclosure, when it started, you know, when I presented in January, I think we had our first meeting in February, then our next meeting was supposed to be in March. And I remember the first meeting we had once COVID got started, was just getting in the throes of craziness. And I honestly was like, I think I reached out to Dr. Smith and one of the prior presidents, and I'm like, is it bad? I just need to take a break. And she's like, no. I says, I am just trying to get all my patients like online and people who need have access to me. And I've got all these fires, people freaking out. And then my kids are out of school, and I had a senior in high school who was supposed to graduate. I mean, it was just crazy. And so just my own personal adjustment to all of this. And then, oh, by the way, let's start a task force. And she's like, Stella, it's okay that you want, I'm like, okay. Cause I feel bad. Like I want to get going. Everyone was excited about it. And then this hit. So I allowed, after kind of hearing from someone else, it's okay. I'm like, I sent it out an email and I said, you know what, we're going to take a 3-month break. Everyone to collect yourself. We're going to connect over the summer. And everyone emailed me back, thank you. I felt validated that that was okay, but it was hard because, you know, you get started. I was excited. People were excited and that hit. And I didn't want that momentum to stop. And then I was like, I have to collect myself. Like not just from a work perspective, but just personally, like just kind of collect, you know, how this is going to look. Everyone's working from home now, and now we have to do school at home. And so it was a lot to kind of figure that out. So, yeah, starting out wasn't as rosy as I hoped it would be. So it was a lot, but it's okay. It's kind of
People made their children pop up on the meetings. Yeah, that's me. I'm calling out, so it's okay.
We're making a GPA policy that is more than okay at this point.
It was sort of like our professional houses and our home houses were all on fire. Like, what do we do with the kids in our life, and what do we do with our job and our work, and how to meet people's needs?
I know I've met all of my clients' pets, whether they're dogs or cats.
Oh yeah,
Fish,
oh,
whatever.
yes.
It's not my dog. So
yeah,
yeah, they're always there.
Awesome.
It's absolutely no fun to be sitting in the passenger seat of somebody's car, looking up at them, driving as you're starting to do an evaluation.
Right.
And you're looking out their back window and are as disoriented as you can possibly be because you have multiple data hitting you.
Oh, no.
And then you have to say really quickly, yeah, we can't do this.
No,
Yeah.
absolutely not.
And they're
I've
like,
been
why
in
not?
several people's
And it's
cars,
like, well,
but none of them were moving. Oh no.
I've had that
Same
happen
here.
twice.
Oh goodness.
Yeah, I shut it down.
Yeah,
I
you
shut
have
it
to.
down. Yeah,
For the
I shut it
patient's
down.
sake,
Yeah,
if
I'm
nothing
like, this
else.
is not
Oh yeah,
okay.
and safety.
Safety.
Absolutely.
I have 2 people who go outside and sit in their parked cars because it's
I
the
do
only
too.
place they can get any privacy in
Any
their
privacy,
home.
any quiet. Yeah.
I've had a client.
I think I would get
in
motion
her closet. You can see the shoe rack behind her head. And
Oh.
she's in the closet.
Well, it's interesting, you know, I mean, you know, this is health psychology or whatever, you know, but it's insurance. It's interesting. If you accept Medicare and you do a bariatric surgery evaluation, you can see the person remotely and do a 90791. You cannot administer the testing remotely. They have to be on site to take the testing. It's like, that doesn't make a whole lot of sense, but that's a Medicare requirement. So there are all kinds of interesting challenges, obviously, just even doing health psychology work during the age of COVID.
Yeah.
That you know, that it's helpful to even have a group of folks to talk to that you can navigate these things.
Exactly.
Does Sharon Cooper's current telehealth bill that's in the, I think it was introduced in the House last week, change that? There's it might be worth looking. We're kind of hoping that it will go through. There's a telehealth bill because, you know, there's also that rule about the originating site and the, which just is just unnecessary. One of the legislators is trying to fix that essentially and to make it permanent so that nobody has to go through that or go back to it. It might be interesting to look into that because I don't remember what I read in there about what that allows for in terms of testing. But yeah, there are some ins and outs there in specific plans like Medicare that just make you shake your head, don't they?
Yep, they do.
Yeah. Yeah. Well, thank you, everybody. It's just a pleasure to get to see some of my colleagues. Absolutely. If anybody has any questions or wants to stay on or talk, you know, obviously I'm the president. I'm happy to answer questions about what's going on. For anybody who may not have heard, we were given a really big award, the Division 31, which is the Division for State, Provincial, and Territorial Affairs, gave us the SPTA of the Year award this year, which is a really high honor. That's some pretty stiff competition. And it's things like, I mean, the Health Psychology Task Force was one of the things we highlighted in our acceptance and in our nomination for that. And so it's people like you all, it's people who contribute their time, who come to a meeting, who share their expertise, that really make the difference. So I just cannot tell you how much I appreciate all of you. So, well, thanks everybody. Stay warm, take good care of yourselves.
Thank you.
Okay.
Bye.
Bye everybody.
Thank you.
Thanks, Rachel. Appreciate it.
Thanks everyone.